So we're going to talk a little about men's health, reproductive disorders, inflammatory disorders of the male genital area. We're going to start with reproductive disorder. It's a disorder present at birth. It is the failure of testes to descend into the scrotum. You have a hydrocele. A hydrocele is an accumulation of fluid between the two layers of tunica vaginalis, a membrane covering the testicle. You have hypospadias. Hypospadias is just where the urethra doesn't open from its usual location at the head of the penis. And then you have epispadias. And epispadias is just a severe type of malformation, which the urethra ends in males and an opening of the upper aspect of the penis. So let's just do a little bit of an anatomy review. The prostate is the size of a walnut. It encircles the urethra. Functions to add seminal fluid. Acts as a valve to keep urine and sperm flowing in proper direction. So you need to know that anatomy to be able to understand why some of the issues that prostate infections and stuff cause, why it causes that. So prostate cancer is a malignant tumor that consists of cells from the prostate gland. Usually grows slowly and remains confined to the gland. It is usually asymptomatic. May have abnormalities on exam. Second most common form of cancer among men. Second leading cause of cancer deaths. Possible causes of prostate cancer can be viral. It can be hormonal, meaning testosterone. It's genetic, and it can increase consumption of fat. Increased consumption of fat can be a possible cause. Symptoms: weak or interrupted flow of urine, the inability to urinate, difficulty starting urination, urinary frequency, hematuria, urine flow not easily stopped, dysuria, or back pain. Detection, like I said, is usually asymptomatic, so the first detection is often by an abnormality of a PSA. PSA is just a blood test, and then it may be detected through an examination. Diagnosis is by a DRE or a digital rectal exam. By the PSA, most men have levels less than 4. Levels between 4 and 10 have 25% chance of developing cancer. Levels over 10, chances rise to 50. Certain medications may cause increased PSA, like NSAIDs, and statins, and others. And if you have an increased PSA, more than likely you're going to get a biopsy, which is a needle aspiration. Prostate cancer stages. Stage 1 means it's confined to the gland. It's not palpable on DRE. Stage 2, confined to the gland, palpable on DRE. Stage 3, spread throughout the gland and invade the seminal vesicle or bladder. And Stage 4, spread beyond the gland into lymph nodes, tissues, organs, and bone. Prostate cancer treatment depends on the stage. Ranges from no treatment to surgical removal. Hormone therapy, estrogen, prevent testosterone production, has serious side effects. Testosterone suppressing medications like Lupron, and removal of one or both of the testicles. Also a treatment is radiation therapy, brachytherapy, implantation of radioactive seeds. I do see this one happen a lot. Chemotherapy used for advanced metastatic cancers. And then you have the transurethral prostatectomy, the TURP. Does not cure or remove all cancer. It just relieves the symptoms. It removes a portion of the prostate that is pressing on the urethra. Continuous bladder irrigation to remove clots. And the catheter to drain urine. Here is a TURP. So what you see is they're just getting rid of what's causing the problem. Now, get rid of all of it, they're just getting what's causing symptoms. Other cancers in the male is you have testicular cancer. It's relatively uncommon. It is the most common cancer in men aged 15 to 35. Risk for developing testicular cancer is only about 1 in 263. And risk factors for the development of the form of cancer include abnormal testicular development and cryptorchidism. It can affect one or both testes, and it's one of the most treatable cancers with 90% cure rate. Also have penile cancer. Cancer of the penis is rare. It generally appears in men older than 50. The tumor is painless. A wart-like growth or ulceration on the glands under the prepuce is present. It is common for metastasis to occur to the inguinal nodes and adjacent organs. It is rare, but it is deadly. Well, I have great spelling right there, don't look at that. Inflammatory and infectious disorders of male reproductive system. Prostatitis refers to the inflammation or infection of the prostate gland. May be acute or chronic. It's most commonly caused by bacteria. You have chills, fever, prostate pain, tenderness, dysuria, frequency, nocturia, hesitancy, arthralgias, and treatment is an antibiotic. Most of the time when people have prostatitis, they are pretty sickly. You have epididymitis. It's an infection of the cord-like excretory duct of the testicle, usually secondary to an infection process, such as an STI. The infection often travels through the epididymis from the urethra. Disorders of the male genital organs. You have phimosis. It's a condition in which the prepuce or the foreskin is too small to allow it to be retracted over the gland's penis. It's usually congenital. You also have a hydrocele, the accumulation of fluid between two layers of tunica vaginalis membrane covering testicle. So basically with that, you just see the scrotum start to slowly enlarge because it's accumulating fluid. And then you have the varicose. It occurs when veins within the scrotum become dilated, usually after internal spermatic vein reflux. Just a little bit about the nursing process for the patient with reproductive disorders. People with reproductive disorders require skilled assessment. Assessment occurs through observation of the patient during the patient's health history and while doing baseline and continuing assessment of the patient's objective and subjective data. Data collection for women, you'll need the menstrual history, including the menarche, age of onset, the date of the last menstrual flow, the usual amount and volume of the flow, presence of dysmenorrhea, menorrhagia, amenorrhea, or metorrhagia. You need a gynecological assessment, including data on vaginal discharge, pruritus, vaginal irritation, date and results of the last pap test, their birth control methods, family history of any kind of cancers, their gravity, how many pregnancies have they had, number of live births, abortions, miscarriages, stillbirths, assessment of the breast, including tenderness in the breast area, pain, masses of any specific areas, presence of nipple discharge, knowledge and frequency of BSE. And in men, you need to collect from the male adolescent and adult male, include urology history of voiding. And difficulties of any discharge from the penis, characteristics of the urine, information on prostate and testicular problems, frequency of PSA testing if they've had that, if they had any masses or lesions on the genitalia, frequencies of TSC, testicular self-exam, frequency of professional testicular exam, measures to prevent infections, birth control method. That is some of the things as you're advancing. You're now in 102 that we're looking at. We're not just looking at regurgitating data. We're looking at how you're processing that data and how, as nurses, you're going to look at these patients and use this information. Okay, that ends about reproductive. Thank you.